I think the number one reason why people come to see us from all over the country is because of our experience and expertise, specifically in minimally invasive surgery. 100% of the surgery we do per year is done through miniature incisions. My partner and I have more experience than anybody in the world in laparoscopic incisions for reconstructing the vagina. We have the biggest series in the worldwide literature in laparoscopic sacrocolpexes. This has set a precedence throughout the world as us being leaders of minimally invasive surgery. And that's why people come to see us. If you have an incision this big, it's a 3 to 4 day hospital stay. Incisions this big, it's overnight and then to a local hotel to recover. Patients have minimal incisions, minimal morbidity, less pain, less discomfort, less blood loss.
We were some of the first to really go out and change from making a big incision in the abdomen to be able to do the surgery through a little incision in your belly button, and you only stay for 23 hours. Your recovery at home is one to 2 weeks instead of 4 to 6 weeks. Your stay in the hospital is either outpatient or 23 hours instead of 3 to 4 days.
We had an independent survey done, almost about 8 months of patients. And the company that did this independent survey told us we have the highest ratings of all doctors that they've done so far. Our overall rating was 91.25%.
The advantage or benefits that we have and we give here at our center here in Atlanta with Dr. Miklos and myself is the fact that not only do we have our initial training in obstetrics and gynecology, we understand the trauma of childbirth, we understand the initial repairs that are done at childbirth and the damage that's created, but in addition to that, we also have 4 additional years of training in just vaginal and pelvic reconstructive surgery.
Recently, people have developed the robot. The robot is a liaison between the surgeon and the patient. The robot is not something new. It's still the same surgical procedures that I do, but the doctor needs training wheels to perform the surgery.
It takes them more time to set the robot up than we can perform the procedure laparoscopically.
They use the Da Vinci robot because they cannot hold the instruments themselves and do the surgeries that I do. So they had to develop a $1.5 million machine.
What it really should be called is robotic-assisted laparoscopic surgery. And what does that mean? Well, there's many procedures that we perform laparoscopically that are very difficult to do.
A lot of times patients will go to our website and they will see all the surgical procedures we do. They understand that we do more of them than just about anybody in the world. Just like cosmetic vaginal surgery, we have the largest series in the United States on labia minora reduction surgery. I'm currently putting together the largest series in the world on labia minora reduction surgery. Nobody has a series as big as we have.
This year alone, as far as internationally, we have taught, and I've traveled to Russia, Finland, Chile, Argentina, and Taiwan, either to teach, to do surgery, to present international research, all internationally.
And most of our surgeries, both Dr. Moore and I, are working on you simultaneously. So you're getting twice the amount of expertise on one patient.
Both Dr. Miklos and myself had the advantages of training with world-renowned surgeons. Dr. Miklos was trained by Dr. Bill Say, who was one of the first surgeons to ever do a gallbladder surgery via the laparoscope. I had the benefit of then training under Dr. Miklos to learn all these techniques as well.
It's easy for people to make an appointment, and part of the reason why it's easy for people to make an appointment because we sort of have a boutique practice. I see 4 or 5 patients a day. That's it, twice a week. When you call up, it's easy to get an appointment. We're not usually booked more than 3 or 4 weeks out.
We do over 500 surgeries a year at our center, and we do them all laparoscopic or all vaginal. And with those type of numbers, we were able to gain a huge amount of experience to really be able to do anything through the laparoscope.
We try to make it as beneficial to the patient as it is to us. We try to do our best by limiting the number of patients that we see, spending more time with each patient on their initial visit, and giving the expertise and the quality assurance that we have from our experience and expertise to provide the best quality surgery that the patient can have.
We have patients travel in from all over the United States and actually all over the world. In the past few months, we've had patients from Trinidad. She came in for a laparoscopic or minimally invasive repair of a bladder fistula. She was repaired in her home country. They did a big abdominal incision in her. She found out that we have expertise and can do that same repair through a small little incision in the belly button, 23-hour outpatient surgery. She flew in and she had her repair done.
I've operated on approximately 3,000 to 3,500 patients. It's hard to say for sure, but the last 3 years, we averaged between 440 and 505 patients. So about 500 patients a year.
There's no place else that these women can go that can get more experience, a better reputation, and more expertise in any field or form of vaginal reconstructive and cosmetic vaginal surgery than here at our center in Atlanta. What we did was really take our blinders off and start listening to patients and realize that sexual dysfunction is a diagnosis. There's nobody out there that has more experience or training than us in major pelvic reconstruction, and now we've combined the cosmetic work with this.
People come to us because we have the experience and expertise. Experience, expertise done correctly yields great results.